Hello, my name is Peter Knapp, and I'm from University of York and Hull York Medical School, and I'm presenting a review of reviews that we conducted about why patients take part in research, and then looking at how those barriers to participation can be overcome. This is really important research, I think, because what we want to do is to have research to inform decision making about healthcare and policy. But what we know is that only a minority of patients take part in research, that it can sometimes be a challenge to recruit patients into research, and this impacts on both the kind of timely completion of research and the cost, and the ability of research to answer the questions that it sets out to do. And it's a particular challenge for randomized control trials. If the sample size isn't achieved, then there won't be a definitive answer which comes from that trial. So we were aware of a number of primary studies which had looked at this question, and also some systematic reviews. And so what we did was a review of reviews to try to pull that together and then to map them to recruitment research, looking at the primary research, which is evaluated SWOTs, so embedded trials, mostly looking at the impact of recruitment interventions. We did this review with a focus on people's reasons for participation. We weren't interested in patient characteristics, for example, whether men or women were more or less likely to take part in research. And we weren't interested in practitioners' views. We're really interested in what patients thought about their reasons for taking part or not in research. And the interest was in real research participation rather than what you might call hypothetical research participation. We reported the findings thematically and then mapped them against that recruitment research that I mentioned in the previous slide. I won't go through all these bullet points in detail, but we used, I would say, good practice in systematic reviewing, methods that would allow this review to be replicated and which also reduce the potential for bias. And potential systematic reviews in the overview were evaluated using the AMSTAR rating scale, and we only included a systematic review if it scored more 4 or above on that scale. And we ended up with 26 systematic reviews, so a huge amount of primary research, more than 400 unique primary studies, which were reported in 26 systematic reviews. And what did we find? So when we look at the facilitators, the things that tend to lead to a greater rate of participation in research, then there are 5 factors that we identified, and 3 of them really dominate. So the potential for personal benefit, and that can mean a number of things. Altruism and having confidence or trust in the physician or the research, those appear in a majority of the included systematic reviews. They are factors that are cross-cutting, really. They are pertinent whether across a number of contexts of research, a number of health settings, a number of types of research design and countries. So they are, I would see, as quite generic features that tend to facilitate research participation. And then there are 2 factors that appear much less often, so whether the research is low burden or convenient, and the potential for financial benefits or incentives for the participant. There are 2 factors that we identified that can operate either as barriers or facilitators. One of those is the influence of physician, family, or friends on patient decision making, and then the other one is information quality, so patients' knowledge of the research. They can operate to either impede or facilitate research. When we look at the list of barriers, rather depressingly, there are more barriers here that are listed than there are facilitators, but they tend to be quite disparate, and they tend to appear in relation to certain contexts, certain patient demographics, and certain types of research, such as randomized controlled trials. So fear and perceived risk and the practical difficulties are the most common that we identified, but then there are others, not trusting the researchers, particularly around ethnic minorities in the States. I suppose there's a tendency for that to be there, and an aversion to randomization or having strong preferences, things that occur really in relation to randomized controlled trials. When we map those against recruitment research, what we see is lots of opportunities to undertake recruitment research. Thank you. I'll be pleased to answer questions, and the full details of the research are published here, a paper that was published in Trials earlier this year.